That is on page 11 of 39
Okay.
on the grid section for HR.
Okay.
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 And we've had lots of discussions about this, and I feel like, you know, in some ways we could almost not emphasize it too much, because if you saw the example that was used in the other workbook that was demonstrated, that she actually pulled that out from all of the information that we've discussed in the past and created the decision plan on it. But I think it's still important for us to identify who is responsible, because that's going to be something that's going to help in the decision making later. So we first need to identify, is this dependent in the hybrid model? Is it interdependent, not interdependent?
I would think would be interdependent because of the need for support from our own student services and our own mental health specialists. I do think that we would need advice going forward to, because it's not just the students that are impacted, but staff.
Yes, and our emphasis is on the staff and what happens with specifically for staff. So Alexander, are you with us in the same space? Yep, I see you there. Awesome, thank you. And then does that look the same for us if we're in the virtual? I think it does. I think it still has the same implications, and probably more so in the virtual than in the hybrid, because we know that the connectiveness piece is the piece that gets sometimes a little lost in the virtual. So also interdependent. And then we need to look at who would be, or what are our resources. I think that we already have in parentheses our employee assistance program contract, and maybe we can get Suhan to kind of chime in a little bit about, is there anything else connected to EAP or that we have access to through our health insurance plans? That might be something we look into. Is there anything specific that any of our plans are doing that would also support the mental health part?
We actually, with United Healthcare and Kaiser, they both have a lot of information about related to COVID-19. Telehealth is a big thing, and you know, mental health parity is there with
Right.
our health plan, so our employees can access that. We do have the, we do put online on our ACPS website under the medical plans for United Healthcare, and I think that actually when you click on benefits, and Debbie, feel free to correct me or you know, chime in, we post the information under COVID-19, you know, and then what's available for our staff.
So I think that HR, you know, in terms of who is responsible, we probably should put HR, obviously list HR there. And then underneath that, put EAP, health insurance. And I think that we could probably in HR just look into what specific programs. So I know, for instance, Kaiser just rolled out 1 year membership for all of their people for Calm, the app. If you ever see the commercial for on TV for Calm, and they have like the meditation, and you know, and they'll say sit for 30 seconds or whatever. So that's something that's being offered for free for 1 year. That's usually a paid service during this time through Kaiser. So if we know of things like that, we could be the communication vehicle for employees to get that information. Internal.
I have a question. How would that be communicated to employees?
And that's what I think we have to talk about. I think HR would have to look at, I mean, we have the information, and I'm just thinking out loud, so don't lock me into this, but you know, we know who is assigned to which plans. So if we know it's being offered, like things like the app to members, then we would create some other type of communication to let those members know this is something out there as a mental health resource, as a support resource. The other thing that we don't do a lot of in ACPS, but it's something that could be, you know, formulated. It could be that some kind of like affinity groups, or there's other things that support mental health that don't have to say that it's a mental health thing. So if there are group affiliations that people can connect with, and I'm just, again, thinking out loud, I don't know what they look like, but I know I'm thinking about Gerald Mann right now because he always posts pictures of like the food that he's cooking. There may be a cooking group that's formed, that's an online group, and those people get together, 15 minutes, 20 minutes a week and talk about what's cooking in their kitchen. I don't know what those groups look like, but I'm thinking about things for staff that can connect different groups of staff that would provide not collaboration necessarily around work, but just around life, things of interest-based groups.
And I'm going to tell you some high school, I don't know if you know this about this, Mr. Duncan, but there is a group that was created for exchanging recipes on the secondary level. I just so happened had gotten an invite because I was at the high school at one point. So, I mean, people are starting them, and I think there will be interest in that.
So that could be something that, and I think that, depending on, it could be out of a school, there could be leads that take an interest. We find out what the main interest that people have, and they're designed. They don't have to be run by HR or monitored by HR, but we can set kind of a framework for people if that's something that would support mental health.
So Sandra, can we just do things like in big chunks? Because I know we can get into the weeds right now. And that's what I think we're doing. If we can just like chunk it and get these things answered. Otherwise, we're just gonna be stuck, on a couple of things. If you don't mind, and we can maybe get into more detail later.
Sounds good. So how do you want?
I wanted to say that I do think the exercise type classes and stuff. So I don't know if that's something to keep in mind, even though they can't be in person, I guess.
Yeah, that's Tuhan, I hate to put that back under the wellness part, but that's something that we were doing live in the building, that if there's possibilities of doing that virtually, that might be something we could look in there too as well. So
I'll make a
I
quick
would
comment.
say that,
And Tuhan, I don't want, like Pat don't want to get Dr. Mazingo get into the weeds, but you could work with Running Brook. We have a great partnership with Running Brook and Mike Humphreys that can help start something like that. So that's just a support.
Yeah.
Running Brook and Mike Humphreys. But I don't want to get into the weeds.
Okay, thank you.
Thank you, Dr. Mazinga. So a lot of these, it looks like, are going to fall under HR being the wellness area, championing it, and then being able to build off of who in the organization would be willing to like support or lead. So I think that's good. We have that one covered. Is there anything else you want to add to this before we go to the next block? But these were good starting places. Okay, so let's see the next block. How does our work align with the CDC directives? How do we identify people who can't return if we have a high risk environment in the fall? And then of course, I think again, both of these are, well, it's interdependent for sure for hybrid. It's not applicable if we do everything all virtual.
What did I do?
Nothing.
You're good.
You're good.
Okay.
And obviously this is well beyond just the HR group. I just read something in the paper this weekend that Virginia is actually, hold on, let me find it. I wanted to bring it up to you guys. Virginia implements COVID workplace safety standards. So they put in an adoption of a statewide emergency workplace safety standard. They have not outlined or given all of the provisions in it yet, but it's supposed to happen sometime in the next couple of weeks. So that's something that we're going to also, in addition to CDC, we're going to have to pay attention to what's happening in Virginia. So this goes beyond just HR, but obviously HR is going to be following it along with our other partners here. Capital Facilities will have a big part in that. Obviously the building administrators, I think there's, communications and safety and security are all stakeholders in how we would monitor and maintain in this area. And I guess the information that we need is we need to wait and see what those guidelines in Virginia are going to look like. And we need to continue to follow what the CDC and national practices are so that we can make an assessment of what's best for ACPS. Is there anything else that you all think we need to be considering or questions that we need to be able to ask? We've talked about in our previous discussions how we identify people who can't return. And so we won't go back and revisit that again, so we can kind of stay high level. But just as a quick reminder, we talked about whether or not we're going to have some type of condensed or shortened form that employees would need to fill out and model it under the family medical paperwork, but maybe not as in depth, so that we can get a baseline of who meets the criteria, whatever that criteria will be, in order to return.
Yeah, Sandra, one of the most important thing I think is really the medical documentation, which we may need. That's something that we really need to make sure that our employees know that they have to submit that.
Right. Yep. So those two, yeah, thank you, Alexander. You caught that those two questions kind of commingle and with each other on the form. And the next question kind of falls under the same category because we were trying to address how HR would collect data regarding individuals' capacities and what information is that we need and what if there's condensed medical information that is required in order to assess whether someone can return.
Can I just speak to that issue for a moment? Yes. I think it's going to be very important to communicate to employees that this information will be kept confidential. I don't know. I just think it's real important that we communicate that very often, that the information will be kept confidential, because some people I already know will be very leery about sharing certain sensitive medical information about themselves to HR, thinking that somehow it might get out, or their employer or their supervisor or manager or whatever. So I don't know how you communicate that in the way that people trust that that won't happen, but I think that's going to be very important to do.
I think that you're bringing up a good point, which is why, I preface this with we're going to use kind of the framework of the family medical leave, but maybe the medical information is not going to look as intense as it does on the FML form. And we would treat it the same way we would treat family medical leave, which is we protect the condition and we convey what the responsibility of the supervisor is in terms of the person's work. So same type of framework. And I think if we keep that in mind, then we will meet the legal requirements in terms of privacy protection and still be able to identify the work that can or cannot be done.
I just want to make sure somewhere in here and with Dawn that the mental health aspect of it, I mean, I get the medical, and I'm not sure what the forms look like because I'm not even sure with FMLA, Tuhan, if that has a mental health component. So
it's the same. It doesn't have, it's the same form, whether it's the physical or mental condition. Okay. So that's just not something, there's no really truly distinction. It just,
okay, I'm just, because I'm worried about the anxiety disorders that we're going to have to see. Okay.
Right, it's the same. Yeah.
Is this going to be the same form, or this will be a different process if it's like a family member that has the medical condition?
That's a good question.
I think the form is gonna have to be, what we, if I understand this form, it really should be a very simple, it's a condensed form. So we're not gonna get into too much detail, but enough that you may, that's something that a staff can indicate, like, condition, staff, self, or a family member, something like that, and they can check box it.
I think what Dawn said is very important. That has come up in several groups outside of ACPS, just about the issue of confidentiality and the security of the information. That's come up. The other two, Han, is what you've said too, is that there are people that have indicated that they have family members at home. So there is a question mark about what that actually means. Do you know how soon this information is forthcoming? That has been asked too. The form, the form that you're describing now, is that in the works? Or because the other part is the survey that Clint just, do you remember the survey, the percent of people and that definitely are likely not to return? I'm just a question in terms of
We
the
haven't done
milestone.
that because there really isn't,
Right.
we haven't created a form yet. I mean,
Right.
our group is kind of charged with making a recommendation.
Absolutely.
But a lot of our recommendations are more reactive than proactive because there's a dependency on
Yes.
what it is that the division, what format the division is going to take. The form is going to look different
Yes.
based on the models that are presented. So in some ways we're doing a lot of, we're trying to predict, but we need the concrete decisions to be able to understand the formatting that needs to go out and what questions to ask.
Right. I agree.
So one thing I want to mention is that we do have COVID-19 form on our ACPS website. So that's just something that's already out there. So let's say you, a staff, may wants to consider not returning to work. They can go online, look at the form, because that form also has information that they can put in for a family member. It also has other information about childcare. If they cannot return to work because of that, that form is out there already.
Okay.
Okay. So the next question, will there be an appeal process for employees to pursue if they're moved assignments that they don't want, or denial of telework or other requests, or any other kind of requests regarding return? And I think that, we've asked that question. So the answer that we need to give, or the recommendation that we need to give, is, do we believe that there needs to be an appeal process? And then it's later decided what that appeal process would look like and what would be the outcomes of an appeal process. Because we're making, again, assumptions that there's going to be some adoption of flexible staffing. And as we heard in the big meeting today and the discussion of budget, we were probably right. We were probably somewhat on track in our thinking when we hear now that the budget is basically a big bucket instead of individual cups. So we were forward thinking in that regard. So there's a high probability that's going to come. Not our decision though. So our answer is, do we believe there needs to be an appeal process? What will that look like? And then in terms of flexible staffing, whether or not people will have a choice to telework or not telework outside of medical condition. I think that's a caveat we need to put on there, because we've already talked about what would happen if there was a medical issue. But would there be a flexible staffing options for those individuals who don't fall under one of those protected categories, is that going to be an option?
That answer might be different also based on employee group. Because there are some employee groups where telework may be possible and not a greater burden for them to do if it's just a preference instead of a requirement. But there are other employees where physical presence is really required. So it's going to have to be one of those maybe yes, maybe no kind of.
So Alexandra, on the block right below it, because it gets more specific there where it says, will teachers and staff have an option to return in person or virtually? I think this would be owned by HR and program or management leaders. And it would come down to identifying what Debbie just said. The recommendation would be to identify those positions that are telework
compatible.
Yes, exactly. That's I was like, what is the word? Yes. Telework feasible, telework compatible.
Yeah, that's good. Mm-hmm. I think this is what you're going, the discussion now kind of goes back to what Christina was saying as you're thinking through is what are the groups that are affected? Like you said, those that may have some at risk, those that may have family members. What are there other groups that might be impacted and would need to have some type, or I think teleworking categories, right? Non-teleworking categories. This is complicated, but you have to work this out because so many people will fall in different categories and you have to have options for them.
Mm-hmm.
And then maybe reassignment. I mean, how do we,
yes. Mm-hmm.
What do we do with our cafeteria workers? I know probably they're working on that with
Exactly.
nutrition services, but those people who need to be reassigned.
I think that's a real question
we
too.
had that up in the, I think, we talked about that in the last session about just the repurposing of positions.
Okay.
Sandra, would that have policy implications? Because there would need to be some policy language around what that looks like in terms of repurposing or reassigning. I don't know, on the policy end of it, because, if you have a process, I feel like that needs to be documented somewhere so that people know the process and know what their options are if they feel as though the process hasn't worked for them or hasn't worked appropriately.
Right. I can tell you that just broadly speaking, in terms of policy, what we have in policy basically says, the superintendent has the ability to reassign and without impact to your property right. So it works going upward or downward, but we have to think about whether it works going upward, meaning if I am a cafeteria hostess and I am now being charged with, I'll just make up a position. They're going to make me a substitute teacher. That's a difference in assignment and pay grade versus people who are interchangeably being used. I think when we talked in the last session, we talked about specialists like a coach or interventionist versus, the support staff. Support staff gets a little bit more tricky, but for teachers, I think we pretty much understand there is flexibility to do that. But you're right, if we go beyond those parameters, we need to determine what are the guidelines, what are the stipulations, what are the periods of time in which we would allow that to take place without looking at salary benefits and all those other things. So thank you, Don, for bringing that up.
I think you're absolutely right about that. I think that's why Dr. Hutchins reminded us, what was it, last week maybe, too, as we move forward, continue to develop the playbook, we have to think about if we were in a virtual environment, what would be some of the responsibilities of some category of employees? right? So that, you know, you got to figure, and who are those employees and what are their responsibilities if you're in a virtual environment, right? So I think
Yeah.
you're on the right track.
And then remembering the exempt and the non-exempt categories, I think that's important that we
Yes.
even have.
Good point, Pat. Thank you.
Great discussion. Bye-bye, everybody. I got to go to another one. Good discussion.
Bye,
I think this
Dr.
is the heart
Mazinga.
of another, one of these areas. This has major implications.
Major.
Yeah,
So Alexander,
bye-bye.
if you would just make sure that underneath there, I just want to make sure we capture the exempt and the non-exempt in this discussion.
One thing, and this might just be like a small detail, but are certification requirements going to be relaxed? Because I was just talking with some of my EL teacher colleagues, and some of them actually aren't certified, you know, in elementary ed. They're just certified in EL. So we can't necessarily assume that they can.
Correct. Yes, we've had no direction from VDOE at this point on changing or relaxing requirements. The only, you know, we do have some flexibilities when someone is deemed a long-term sub per se versus being classroom assigned for record purposes, but you're correct in your statement. We will not be relaxing the requirements to be classroom facing. We're going to follow whatever VDOE requires. It looks like we have the same question. It looks like maybe the same question again. I don't think we need to answer it again about the staff mental health resources. We've already answered that up front. I don't know how it got duplicated down here again, but yep, thank you. Okay, on
I
the
don't know
next.
who wrote this in.
Hmm?
Oh, I'm sorry. Okay, never mind.
Yeah, do we need to, I don't know who put that in. Do we need a tiered approach to staff's return? Anyone with underlying medical conditions, for instance, would be considered on the first tier of online instructors. And we've kind of talked about this and identified it as well. And I think the question that goes on the end column goes back to program managers and human resources, identifying positions and or persons through the recommended survey or form that we would have people complete. Are there any other thoughts or questions that we believe we need in this category? Again, the question is, do we need a tiered approach? Or are we going to recommend that there's a tiered approach for staff return, i.e. anyone with underlying medical conditions would be in the first tier. And then we talked about in the second tier might be those people we talked about just a moment ago that would prefer to, or it's an option for them. Are we going to allow that as well?
What about like childcare before, those that have like childcare issues before just preferring? I'm not sure.
That's
I
a
think
very
that's
good
the
point.
idea. Yeah, but I think that's what we were talking about with the tiered, the ones
Mhm.
with big and medical, then the
Mhm.
ones that were childcare, and then the ones that just wanted to do the virtual versus in person.
So back to the question was, if they are medical first, do they have to provide that doctor's note?
Well, that was the form that we talked
We
about
talked about,
earlier.
okay.
Yeah,
Yeah.
that's that we have to evaluate a form that's in alignment with the FML, but not as much
Mhm.
documentation.
Mhm.
And we would use that to identify those people who meet the conditions under the COVID-19 guidance, CDC guidance, and now considering the Virginia guidance that hasn't been published yet, but that could also, it could lax, or it could relax, or it could be more stringent than the guidelines that are out there.
And then I'm just curious, how do you prove childcare? I mean, is there going to be a research in far as the childcare is concerned, or is that even necessary? I'm just curious.
That's something that we also posted on the COVID-19. That's part of it. We can, employees can show like giving the link to a childcare center or a school location where their child attends, and that place is not
Facility is
open.
closed.
That's acceptable. So all of that is out there, yes.
I'm sorry, but with the family member component, that would be just under the first.
That'd be under the medical, right?
Okay.
Because remember on that form, Juhan said that you would check off for yourself or a family
yeah.
member, someone in, yeah.
Okay.
Okay, and the next question that we had talked about, should leave policies be reinterpreted? For example, like health leave, will we continue to treat this as a FML concern? And I think those are recommendations that we need to consider. So it might take, it might be good for us not to finish answering this question, but instead everyone take time between now and Wednesday to go and look at our leave policies if you're not familiar with all of the different leave, because if you don't use it, then you may not be aware of what we have or don't have. I will send out the link to everybody at the conclusion of our meeting today, and if you can take a look at it between now and Wednesday, that way we can make a decision on what the recommendation is that we would like to make in this regard, or if we think that there's any reason to even be considering any changes or modifications on a temporary or long-term basis regarding the way that the leave is interpreted at this point. Is everybody okay with that? Us taking a look at it? Okay, perfect. Let's go to the next one. Oh, I don't like this one because it's so long. What are the supports for training that are needed to maximize staff's capacity to utilize virtual instruction? And we know that this is not our decision as a group as a whole, but we know that it's important in terms of staff support. So we need IT feedback, curriculum instruction feedback, professional learning and development. I think our recommendation should be, though, I mean, it's like we can make the recommendation and we need to strongly state that we believe that there is a strong need for training that's going to maximize staff's capacity to use instructional technology and instruction. So that can be our recommendation, but it's contingent upon these areas being in agreement and they kind of own the work.
That's throwing me off.
What's throwing you off?
There's someone typing and I'm trying to.
Oh yeah, it moves the screen. If someone's in another, it does. If someone's typing somewhere else in the screen, it hits, it does, it bounces you. And I think the next, the next question is also one that like we can make a recommendation, but we don't necessarily own the work. And that is, how to modify assignments for staff in virtual work, what's most important, what can be removed. That's really the program, program managers, instructional leaders. It's going to be dependent on, we can make a recommendation to them that they need to look at current work and assignments to determine what is most feasible in the virtual world and what things maybe are not necessary. But we don't get to make the decision as HR or as this group about the priorities of any work area.
So this wouldn't be interdependent, right?
Right. Because we don't have a, yeah. And this one, I think for the next question, Alexander, I think in the box we need to say we've already addressed this in a different question instead of answering it again. Because this is about people who are not identifying workers who don't have work assignments that are conducive to remote. And I think we've already kind of discussed that. Yikes. Okay, another fun question.
Are those all of those positions still paid, or is it possible that those type of positions are going to be laid off or something like that?
I don't want to say yes or no to anything, but I would say, given the discussion we heard regarding the budget and monitoring closely, I think that there are probably some assumptions that can be made in order to pay for X. And if this group of employees is not working, or this group of employees is not doing X, we would use that money to support another area. That's what I heard, but I don't want to speak on it because I don't know enough to. Did you all hear anything different than what I heard? I guess is the question.
I heard the same thing.
I heard that.
Let's say from an HR perspective, I think it's going to be that type of communication to the employee has to be made in a timely way if something like that were to transpire. So I think from the HR perspective, there needs to be communication with employees that might be impacted in that manner, because it can't be a situation where you have a job one day and then a week later you don't have a job and you're just notified at that particular time. So I just think from the HR perspective, there needs to be constant communication with employees about the status of their work, of their employment.
And I would say that's not just HR, it's also budget, because HR gets to be the bearer of bad news in most of these situations. We're not the decision makers. I mean, we're not. And so I think HR's role is to support the employees in transition and options, for sure, and explain to them what rights or responsibilities they have, whether it's through unemployment insurance, eligibility for rehire, all of those kinds of things. But some of the messaging is bigger than our department. It needs to come from the people who are making a lot of the decisions.
I guess I was just thinking from the perspective of any type of thing that has to do with job typically comes from HR. So I guess I was looking at it from that perspective. I'm not saying HR taking, total ownership, but in terms of the communication, I think employees need a department that they have regular communication with about the matter, if they're not going to continue to be employed with ACPS, or their job somehow is going to change.
I lost what question. Yeah, the screen moved. Wait a minute, where am I?
How will employees be evaluated?
Oh, yes. Okay.
And that's
So that's a hard question because I can tell you that there is a team that's working right now on modifying and reestablishing the parameters around, well, it's for teacher evaluation, not for staff. So, and while I'm in the peripheral of that group, I'll be honest with you and say, I don't know what it all looks like right now. So this is a hard question to answer, except to say that CNI, HR will continue to work collaboratively on the communication pieces that go with this. And
But you're right. There is a meeting on the 22nd.
yeah, I
With that
have,
group. And they're also then going to be sending out the draft of the new evaluation process. So yes, it's contingent upon this other group and having that sent forward.
yep, exactly. So I think we'll have to hold on it. And I think the only thing that we could probably put there for a comment is our recommendation will be that any changes to the evaluation system will be communicated to all staff. This next question is really interesting. Actually, I had a discussion this morning before this meeting with the recruitment team, and we were discussing how to handle substitutes in the fall in terms of covering, absences. And while we're just fleshing out ideas, I'll share them with you just so you have an idea of what we're going with. But we started thinking about, our substitute pool and who's out there. And we are not blind in knowing that not everyone is going to be suited for doing virtual learning. So what we're thinking about establishing is some type of cohort of substitutes that we can, not necessarily HR either, and this is in collaboration with like CNI and technology, that we can do some intensive training on online platform, instruction, and that they would be like kind of the first line of defense when there's absences. Because the way it stands right now, it just isn't reasonable to think that we can just have our substitute pool out there and that we could plop any one of them into like a virtual environment if that's what we were going to do. And even in the hybrid environment, I think that there's going to be some expectation that you're still going to need that strong technology background because you're kind of doing this mix. I mean, I think teachers in and of themselves, even if we had a hybrid where we're coming back, are going to still be relying upon a lot of strong technology base for their instruction because they're going to have to flex and it would be creating like more work for them. The other thing we started thinking about is that there are some schools that we know that and we're kind of doing this in summer school as well, if you knew you were going to be out during that block of time when you're teaching, they may have pre-recorded lessons, which would lessen the need for a sub. So if you knew you were going to be out at something that you could pre-plan, we're always going to need some subs. But if there's something that you can pre-plan, it might be the pre-recorded lesson and then additional office hours or some other type of supplement to give students an opportunity to get additional feedback or reinforcement of learning if they could not capture it themselves through that video platform. So these are things that we could think about in terms of long-term and short-term. And then I think the other bullet point we already talked about is, and we keep going back and forth, and that is the flexibility of staffing, other individuals to cover that may not have a full classroom time or have other job responsibilities.
So is this like what we sometimes meant as repurposing?
Yes,
certain
that's
jobs?
exactly it. That's it. That's the repurposing. Exactly. And it flows right into the next question. Our things are, we're really, our thought process is good here. The questions do flow together. Do we use these subs? Where's the training, the technological access, and the budget implications? So we also talked about this in our recruitment meeting this morning, and some of the things that we think that would be strong challenges, and this comes down to budget, is the access to laptops, ACPS email addresses. I mean, we think it's just like, oh, they can assign the email, but we do have costs determined on how many users we have in our system. So our substitutes right now do not have ACPS email addresses unless they're doing a long-term assignment. So that would mean that all of the substitutes who would be active in our system, we would have to not only assign them an ACPS email address, we would definitely need to do training on our platform, particularly if teachers are planning on using, I guess you guys are using Canvas. We're trying to direct people to use Canvas more and more. They would have to be trained on that. They would need to be trained on any other, instructional platforms that we're using that are technology based. And the other piece that we need to think about is, what about internet access? Again, when we're talking about support staff, employees, and substitutes, these tend to be our lower paid, lower income staff. They may not have readily accessible means for the amount of email capability or internet capability that's required to do the job. So how would ACPS supplement that or need to look at that? So those are kind of things that we would need to be thinking about as well.
We possibly even reach out to some of our recent retirees. If they would be willing to be temporary substitutes in a virtual setting.
That's a possibility, and I'll let Tuhan and Debbie kind of talk about that a little bit, because there could be financial implications for people who have retired from our system and are collecting a retirement benefit and them coming back to work. So it's not a practice that we endorse 100%, but in a substitute capacity, there might be a little bit more flexibility than rehiring them. Tuhan, you want to talk about that a little bit?
Yeah, I mean, we can employ our retiree who draw a pension from VRS. It cannot be full-time though. It has to meet the hours with VRS, which basically mean part-time. And that's something that we just have to keep in mind, that we need to monitor that. And it's really not only the responsibility of ACPS as an employer, it's also the retiree's responsibility to make sure that they don't work full time for us and exceed the hours.
Okay, thank you, Tuhan.
Yeah.
Debbie, anything else? You're our retirement expert as well. Is there anything that you need to add or think about?
No, we do have retirees who are substitutes currently, and I imagine that they will be willing to continue to act in that capacity. And all of them are aware of the maximum hours or days that they can work. Any recent retirees, anyone who retired this July 1st, they would not be able to start working until October. So that's a consideration if you were thinking, ooh, we'll ask so-and-so to come back. They wouldn't be able to start right away. That's pretty much the only limitation on any recent.
Good to know, though. That's good. That's a good point. Really good point to know. The other thing I think that that this brings to our attention about substitutes is that we would, just as we need to for staff, outline what the responsibilities are working in either a hybrid or virtual environment, we would need to do the same thing for our substitutes. Because again, when you think about that population, and Pat just brought up, these are, a lot of those folks are people who are in retirement age. They're going to naturally fall into some of the high risk categories just by default. And so what does that mean to us as an employer? There may be people who fall in those categories who still choose to work. They may fall into a high risk category, but they decide they want to work. Us as an employer, maybe we need to think about what is our responsibility or liability, if any, by allowing people to continue to work. And that kind of trickles back into the questions that we had earlier about workers' compensation. And if someone does contract COVID, we just want to make sure we're keeping the division safe as well. So it's just questions.
Hey, Sandra, what I was thinking about also, because I know you talked about like the instructional practices too for the substitutes, but I was thinking about more things like acceptable use of technology, as well as social media policies. Like, you know, a substitute, it might not be as meaningful for them if they were just a substitute occasionally, but if they were going to be doing it in a more you know, regular capacity, then those types of things would need to be addressed. I don't know if that's a part of the regular substitute training or not.
We still go through the policies with them, but you're right, they don't mean I mean, we go through those policies with them during their orientation, but not all of them stick because they don't practice them. So your point is well taken. One of the things that we talked about in our team meeting this morning is what would be a revised training in this virtual environment look like for a substitute. And we did say that, like, you know, maybe it's like 2 hours a day for 5 days, but day one would be like HR policies and procedures. Day two would be technology services and how to access things. And maybe that day three is also like a practice. They learn it one day, they log in and do a practice something, access a lesson plan, do a virtual Zoom practice with, you know, the people who are in there, the team. Day four might be CNI, doing something, or safety, you know, the same kinds of things we would give teachers. So just again, thinking out loud, we were trying to just like brainstorm on what things we should be considering. And that's kind of what we came up with. Okay, so I think, was that the last one? I think so. Okay. So now I think we need to go over to the far column, because that's going to drive what we do on Wednesday, and start back at the beginning of our list and determine if there's any additional information that we need. And what is it that we think we want to recommend to the division regarding each of these statements? And this kind of gets pulled into that other document the next session. Does that sound like a plan?
Mm-hmm.
Except we only have 5 minutes left. Well, you know, they used up a lot of time this morning. It's like, you know, they're not even giving us, you know, an hour anymore. So what health and safety guidelines, i.e. social distancing, will ACPS follow? I mean, our recommended guidance is going to be that this group is recommending that we follow whatever guidance is from the CDC, the state of Virginia. I don't know that these are like rocket science answers, but we've already said that we don't own all of this. So the recommended guidance is to follow the established CDC, state and local guidance in this area.
Did we already do did we skip the first one? How do we effectively and safely train staff prior to the return of school? I'm not looking at this right. Because we just did the one, how will social distancing guidelines be communicated, right?
That's at the top. That's the first one I have on our list. Do you have something else?
Maybe I'm on the wrong sheet then. Because my first one says, how do we effectively and safely train staff prior to the return of school?
I might be at the wrong place. You're probably in the right place. Yeah, you're right. My page moves.
Oh, okay.
My
I just
page,
wanted, I'm often in the wrong.
it is. My page moves. Like, when I can see when those other people are typing too.
Yeah.
And it's like the other page. So you're right.
But it's the same thing. Follow
Yeah.
established CDC, state and local guidelines.
Yeah, it is. Because again, it's not really our,
Yeah.
it's our question in terms of staff, but it's not our response is not, it's not our charge.
So would it be the same in both these boxes?
Yeah, I think so. Okay, on this one, yeah, I think you're right for number 1 and number 2.
That next one is going to be.
Well, I think for number 2, I think that that communications is the one who leads the charge, but that HR will support for the second one, because that's about how are we going to communicate. So I think HR will partner with and support communications plan and ensure that any avenues that have employee touch, that we outreach through those pipelines. And for the next one, which is kind of like what Don was talking about, and that is identify, HR is going to identify the communication channels to ensure that all employees are notified of employment changes. And I think that, and you could put like, i.e., it could be through talent ed contracts. It could be through email or mail distribution, websites, etc. How will we fill any staff shortages? So I think here our recommendation is to identify our potential workforce, i.e. substitutes, enhancing our substitute pool, or repurposing of positions. What is our plan for supporting mental health for staff? And I think that I mean, we're kind of re-answering the things that we've already said, but it's the human resources in parentheses wellness will identify resources and communications based on, and I think like the example would be based on enrollment in healthcare programs, free services and for pay services, because some of the things through healthcare, you might have to pay through your copay, but there might be other services that are of no cost, no or low cost.
Mm.
And I don't know who owns that because we haven't really said who owns it, but I think we need to recommend that, and maybe it's, I mean, I hate saying everything's professional learning because they probably get sick of hearing us say that, but identifying groups or outlets in ACPS for team building. You know, it's like those things that we were talking about, the exercise group or the cooking group or the whatever. But I don't really know who owns that. So, I mean, like how to recommend it, if you guys can think of some verbiage. But I think we should recommend to look outside of established groups.
I mean, if there's like a database or a partnership list that ACPS has, that information can be made available to building principals.
Okay.
And they can disseminate that information. Like usually, you know, there's like a staff board or, you know, something, some type of like group in the school. Like we have a Sunshine Committee that communicates to staff where they can go, or our nurse will communicate wellness things, you know.
So
what about
our wellness champions are typically the nurses, school nurses, as well as our
okay.
teachers. And then, you know, it depends on the schools. Some, you know, we actually, HR and the wellness group actually would also work with the principal as well. It depends on the schools. But really, the wellness champions is whom I'm thinking.
Okay,
Who would
so
be able to
maybe
help
it's
us.
maybe it's just saying utilizing the wellness champions to, I mean, we're not asking them to start the groups. What we're asking them to do is to see if there's a needs assessment. They can do like a needs assessment to see what employees' interest base where they're at.
Right, and also for them to disseminate information, because if you know, employees would pay more attention if the email comes from somebody they know rather than from like some sort of mailbox that they may not recognize.
What about our community partners? I know we had, Dr. Mazingo had mentioned Running Brook, but we also, with the community partners in that community engagement office, they should be able to have some things to offer as well for support.
Oh, so you know what? You brought up a good point, Pat. So maybe in that list of like where it says HR, Alexander, can you also add in there like the community partnerships team? Because they would probably have, I mean, we would be running around trying to capture all this information and they probably already have it.
Right.
Yeah. Okay, we're at 11:04, so we're over. I don't want to keep you guys longer than, but I think we made good progress today. So thank you, everybody. I think we're moving along here. We will meet on Wednesday. My task is to send you the leave link so you can look at our leave types. So we can have discussion about that on Wednesday. Use the same link again on Wednesday for the main group and for this group. And I guess I will see you guys again then.
Thank you.
Hey,
Thank you, Duncan.
Have a good
Happy
night.
birthday again, Duncan.
Thank you so much. Thank you.
And it was
Thank
and it
you.
was me.
birthday.
I have to admit, it was me who was correcting. I was just doing a spell check for you.
No,
So-
you're fine. How do you all change it to anonymous?
And why do you want to be anonymous?
I just don't know how to do it. I just want to have the information.
I mean, yeah, that's a good question. But why do people go anonymous? I'm just
How do you
curious.
do
The
that?
people who are anonymous are those people who don't, like Sima and Natalie and all those people who are from the educational element.
Oh, got it.
I
okay.
think because they don't have an ACPS email address,
Uh,
these little animal icons come up instead,
Yeah.
and
But
it
there's-
doesn't have their name attached to it.
Oh, okay.
there's a lot of people that are anonymous. What are you going to do for your birthday?
Oh, I celebrated over the weekend.
Okay, what did you do?
Just
Did you-
have fun.
So, in other words, he's like, what's
None of your
what
business.
happens
None
on
of
Zoom
your
stays on
business.
Zoom.